Good night. I'm going to talk about overseas doctor. A. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member state. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. A specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training. The GP register is a register of all those eligible to work in general practice in the NHS. Note, for full details of the General Medical Council, see www.gmc/uk.org. B. The PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take a Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective, structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios known as station to assess professional skills. PLAB station and advice. OSCE assess these skills. Clinical examination, your ability to carry out a physical examination of a simulated patient, and actor training to train it to play this role will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin or anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient, or in some cases the examiner, will be assessed. Skills tests may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC. Airways, breathing, circulation protocol, and in every emergency station. Keep in mind safety precautions like throwing the sharps in the sharp bin and check the patient understand what is happening. Then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. Note, sharps are needle and blades, which must be disposed of safely in a special container called sharp bin. Thank you. Now I'm going to talk about exercise. Exercise 13.1. What kind of registration might these doctors obtain? A newly qualified Spanish doctor, professional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts. Specialist registration. Write the abbreviation in words. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol: airway, breathing, and circulation. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion Training. Complete the text. My name's Musa, and I came from Yemen. I came to the UK about 2 years ago after graduating, because Yemen is outside the EEA. I will only obtain limited registration with the EEA. At first, it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take a PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at concealing the OSCE, you should simply memorize sets of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to proceed to full registration with the GMC. An important step on the road to becoming a pediatric consultant. Thank you. Ahora voy a estar leyendo los ejercicios en español. El 13.1. ¿Qué tipo de registro obtiene cada doctor? Un doctor español nuevo calificado es registro provisional. Un doctor nigeriano nuevo calificado como registración limitada. Un doctor quien ha completado correctamente el primer año de fundación, registro completo. Un SHO quien ha completado correctamente el programa de fundación y ha obtenido un certificado en el training completo después de registrarse en la especialidad, registración especializada. Escribe las abreviaciones en palabras. Cualquier doctor que quiere trabajar en Gran Bretaña debe registrarse con el consultor médico general. Algunos doctores deben pasar el PLAB, el examen del PLAB antes de ellos poder hacer un registro. Este es el examen profesional y lingüístico. Es la parte 2 del examen, que consiste en el OSCE, la examinación clínica estructurada objetiva. En una emergencia hay que recordar el ABC, el protocolo del ABC, airway, vías respiratorias, respiración y circulación. Antes de tú obtener una registración de especialidad, debes tener el certificado de training completo. Completa el texto. Mi nombre es Musa y provengo de Yemen. Vine hacia Gran Bretaña hace 2 años después de mi graduación, porque en Yemen solamente pude obtener un registro limitado con el EEA primeramente. Fue muy difícil para mí obtener un lugar en el programa de fundación. No obstante, hablo muy bien inglés, así que aunque tuve que tomar el PLAB, el examen del PLAB, para enseñar si yo podría trabajar seguramente en Gran Bretaña. Tuve que darle algunas advertencias a los otros candidatos, y tú no puedes simplemente memorizar todas las frases para el examen del OSCE. Es mejor realmente pensar acerca de qué vas a decir hacia el actor y entonar bien las palabras. Después de completar mi año de entrenamiento clínico, yo estuve completa para obtener el registro completo, pero me encontré difícil en conseguir un SHO después de escoger mi especialidad, pediatría. Algunos hospitales ahora tienen que demostrar algún candidato para el EEA.